Alright, for the PA chest, we see the distance between the vertebral column and the outer margin of the rib cage are equal on each side. The entire apeces are shown. We have both costophrenic angles shown. We have the scapula rotated out of the lung field. The mandible is not superimposed over the lung field. We have a minimum of 10 ribs shown. The heart shadow is here, and we see the spinous processes of the vertebrae. Now for the lateral, we have the posterior aspect of the ribs and lungs should not be superimposed. The intervertebral joint spaces of the thoracic vertebrae should be clearly visible. The sternum is in the lateral position. And the apices and costophrenic angles should be included. And the mid-sagittal plane of the patient should be vertical, should not be leaning forward. And the hilum should be in the center. Now for the AP knee, we see the femorotibial joint space is open. The head of the fibula is slightly superimposed. The patella should be completely superimposed over the femur. And in a normal knee, the femorotibial joint space is equal on both sides. For the lateral, we have femoral condyles are superimposed. The patella should be projected in profile. The femoral patellar space should be open, and the fibular head and tibia should be slightly superimposed. Now for the internal oblique medial rotation, the tibia and fibia should be separated at their joint, and the lateral condyles of the femur and tibia should be visualized. The knee joint should be open. The medial margin of the patella should be projected slightly beyond the medial margin of the femur. For the intercondylar fossa, the Beclaire method, the fossa should be open and visualized. The apex of the patella should not be projected into the fossa. The posterior surface of the femoral condyles should be visualized. The legs should not be rotated as evidenced by slight overlap of the proximal tibia and fibia. For the sunrise, the patellofemoral internal space should be open. The patella should be seen in profile, and the femoral condyles should be visualized.